So for my IPE presentation, I want to talk about something that happened in the ICU when I was shadowing. So there was a patient in a room who had just had heart surgery, and so she had a bunch of chest tubes placed in her thoracic area, and she was having an issue where one of the tubes had come out a little bit, and air was sucking into the tube, causing the blood to spatter. So the nurse who was monitoring her called for backup, and multiple PAs came in, including my PA. Some more nurses came in to kind of assess the situation. So the other issue was that the patient was under anesthesia, but it wasn't fully keeping her under. So she was kind of moving and squirming and making noises and making it hard to really assess her. So my PA kind of took control of the whole situation. So he instructed one of the nurses to kind of keep the patient calm, talk her down, explain to her that she can't be moving at this moment. He told the medical assistant to go and grab some sterile supplies that he could use to put the chest tube back in place. He told someone to call the surgeon who had been in charge of her surgery to see if he could give any advice on exactly how they wanted to put the chest tube back in, if they had to replace it, or if they could just slide it back in, and also to consult about the anesthesia. So he directed the other PA to hold the tube in place while he talked to the surgeon, and the surgeon gave him instructions. And then my PA was the one who actually sewed it in. And then the surgeon also discussed with the nurse what medications we could safely put the patient on. And so once the situation was kind of under control and the patient was sewed up, my PA put in the prescription order for the anesthesia. And then the situation was kind of solved and it had de-escalated. So in that moment, it was kind of a very stressful moment. No one knew really what was happening. There was blood going everywhere. There were probably 10 people in that room, each person with kind of a different job. So my PA kind of took charge and was able to direct different people to do different things so they weren't all just standing there freaking out. And he was able to get things done a lot faster because one person was doing a different thing that was necessary at that time. So, and at the same time, the surgeon had immediately been called. So he was on the way while my PA was still dealing with the situation. I think it was really cool to see how they all interacted in a time of stress. I know I was certainly stressed and didn't really know what was happening. But they all stayed calm. You could tell that they were moving quickly because they knew it was urgent. But they weren't freaking out. They were clearly communicating. I think that was really cool, and I definitely learned how people deal with stress when you're in a medical profession, because you can't just crack, you can't just break down in a moment like that. You really need to stay calm, follow orders, put someone in charge, which they clearly did. There was definitely exchange of roles in that situation. One PA was doing one thing, another PA was doing another thing. The nurse was kind of doing her own thing. So all the roles were kind of like being meshed together. They were all working more as a team. They weren't separated by who had what job. They just knew that something needed to be done, and they were all listening to the orders of the PA. And then essentially once the surgeon came in, they all kind of listened to the surgeon. So there was kind of a hierarchy, but at the same time, they were just one big team. So I thought that was a really cool learning experience for me, especially because I had never been in a situation that felt urgent and kind of scary for me. And I also got to see it really up close, which was very cool. And I got to see how they dealt with it afterwards, how they put in the prescription and ended up giving her the medication, and she was much better after that. And they also talked about how to avoid having the chest tube come out again, so they could further be more careful with other patients, because that shouldn't have happened.